Hello, everyone. My name is Shania McGee, and I did my presentation on cognitive challenges in fetal alcohol spectrum disorders. Fetal alcohol syndrome disorder, the effects and limitations in interventions. Fetal alcohol syndrome disorder is a result of prenatal alcohol syndrome or prenatal alcohol exposure. Fetal alcohol syndrome produces abnormalities in physical, formative growth, central nervous system, and neurocognition. It is not curable, so more than likely the symptoms will persist over an individual's lifetime. And even though they do seem to be more permanent than other disorders, if early intervention is involved or set in place or set in stone, the symptoms can decrease and help a person's outcome in life. The purpose of my paper was to review the effects of fetal alcohol spectrum disorders, their effects on cognition, and the limitations in the previous interventions. Haditu Waku did her article in 2009, and the goal of her article, or the objective, was to find out the cognitive profile of children with fetal alcohol syndrome disorder. They found they had trouble with encoding, which is the ability to hold information, shifting, going from one stimulus to another, sustaining and focusing, which is concentrating and remaining remaining or staying on task. Uh, Since focus and sustain was decreased in children with FADS, executive functioning was diminished. Well, they gave them signs that executive functioning was diminished. They also had issues with retrieval and comprehension, so that has everything to do with social communication, language, phonology, and pragmatics were also not utilized by fast children. They also had difficulty recalling shapes that were drawn. Gimbal 2025 did research on the neurocognitive, what happens to the brain when children are exposed to alcohol prematurely, and he found that they had lower means and volume, differences in bilateral hypocampy and bilateral caudate. The differences in hypocampy and caudate and low volumes impact memory, learning, and spatial navigation. These 2020 conducted a test to see whether maternal prenatal alcohol use was associated with psychological behavior, behavioral, cognitive, and neurodevelopmental disorders. The children presented with FADS had greater cerebral volume, regional surface areas, regional volumes. Lee advertised that there should be no alcohol consumption due to its negative effects on psychological and behavioral entities. I used the article written by Hilly, which was written in 2025, to help further explain what interventions actually need while performing these interventions or practicing these interventions with individuals with FADS. Haley found that interventions need to be more context focused to help support participation. She also found that if they're more reinforcing, so using things that the individual may like when it comes to doing work or play or practicing ADLs, using things that the children would like. If the children like planets, let's do planet based. Let's use planets in our intervention. If their thing is tablet, let's do tablet sometimes. So just finding something that's individualized for that individual and that can be reinforcing enough to have them participate. She also found that clinicians must familiarize themselves with all aspects of FADS to help support clients and participation. If the people who are implementing these interventions don't know much about FAST, it kind of goes against the whole intervention plan or goes against the whole idea of helping an individual because you want to know everything about what to expect so you won't be caught off guard and so that you could help them in the best way possible. Flanagan's research was based on the previous interventions that have been implemented with children or individuals with FADS. So the goal of his article was to find out where interventions kind of deteriorate or decrease in effectiveness when it comes to kids with FADS or individuals with FADS. So he found that identification, assessment, diagnosis, and awareness are very important, and that the opportunity to support individuals' needs was also very important or very beneficial. Research concerning long-term impacts are needed. Individuals with FAST often present as with co-occurring diagnosis, so finding the right medical care is something that needs to be implemented or researched so we can further help children or individuals with FAST involved in the criminal justice system. So when they come in with behaviors and they've been exposed to alcohol in the womb, criminal justice system should gain insight to the risk of criminality, living experiences, and caregivers to help display patterns that might prevent criminality in children with or individuals with FADS. So I kind of broke my intervention up into 4 different categories. The first two was parent training and behavior therapy. So as we know that if working in the field of behavior therapy, if the parents aren't implementing the behavior corrections at the house or whatever they may have on their program, if they're not implementing it at the house, then it kind of goes null and void when they come back to the clinic because they're only getting that learning at the clinic. So I implemented parent training, which is the process of providing information about fetal alcohol syndrome disorder, its effects, and its effective parenting strategies. It can be very beneficial for the parents and for the child. Fetal alcohol syndrome disorders. Information can be provided through handbooks, video trainings, and even workshops, and group therapies with other parents too. As important as it is to provide services to children, it is also equally important to provide counseling, advocacy, support groups for the caregivers. Individuals with FADS may exhibit the following behavior issues: attention, hyperactivity, emotional regulation, social skills, and so forth. Okay. As far as behavior therapy, programs such as behavior therapy may be beneficial. Most behavior therapy clinics utilize functional behavior assessments to gather information about the individual, the function of their behavior, and their target behaviors. Target behaviors are then measured and focused on throughout the therapy. Since target behaviors are their focus, replacement behaviors are used as an alternative to the target. Through data collection, behavior therapy behaviors will be tracked and assessed and adjusted throughout the whole process of the intervention and therapy. Next, we have cognitive. Children with fetal alcohol syndrome disorder possess the following cognitive deficits: executive functioning deficits, learning memory deficits, attention deficits, language deficits. Cognitive behavior therapy focuses on thoughts, feelings to alter behavior. Cognitive therapy utilizes cognitive reconstructing, goal setting, time management, emotional regulation, and working memory improvement to help with cognitive deficits. As far as pharmacological, Medications like antidepressants, stimulants, anti-anxiety, and neuroleptics have been prescribed to individuals previously. In my intervention plan, I was looking for a more holistic treatment, which can be nutritional or art therapy or play therapy, something that the kids can kind of go to that's not actually suppressing their feelings and their emotions, but rather supporting those in a way, but just giving them an alternative route to express what they're going through, what they're feeling, what they're trying to say, and so forth. My goals and objectives throughout my intervention plans will be to decrease deficits in cognition and limit maladaptive behaviors that may persist. Also, medications decrease deficits, they don't cure them. So, focusing on holistic and alternative approaches may not completely heal the individual, but gives the individuals the opportunity to not be weighed down by medications or intense therapies. My target population, for anybody diagnosed with fetal alcohol syndrome disorders, ranging from 2 to 10, because we're looking for that early intervention. So, the earlier, the better. In order to implement my intervention plan, it would have to take place in a clinical setting with individuals who are experienced and specialized in holistic cognition and behavioral therapy. To ensure that the clients won't be overwhelmed, therapy will be applied in periods, ensuring necessary breaks. An assessment will be conducted at the beginning, throughout, and at the end of therapy. Behavioral and cognition will be tracked via data collection and graphs. Now we're at our reflection portion of the PowerPoint. This presentation, this project has allowed me to gain access about kids with fetal alcohol syndrome disorders, of course. But just to give a little insight about every section of or every part of the presentation or project. First, I talked about a noted the bibliography. I said that it helped to gather information on articles, allow insight to the major issues concerning the topics, and gave insight to the topic's popularity. I've never written a bibliography before I wrote my literature review, and I found out it was helpful because not only was I able to get insight or get feedback on my articles from the professor, but I also was able to see um, what was in the articles ahead of time before starting on my review. The literature review is my favorite type of research paper. It's like piecing together a puzzle, learning what is needed. When we find articles and we find topics, we have a lot of things that's missing. And most of the time, if we're going to do research on a topic or if we're going to try to do an experiment, we want to know what's already been performed or what's already been looked at or what's already been experimented so we can further ours even further than those who have experimented before us. Lastly, PowerPoint. The PowerPoint gives a visual aspect to the paper, of course, and allows readers a better understanding. Sometimes papers can get a little boring depending on what you're reading or the topic or your topic or anything. So the PowerPoint just gives us a little bit more insight visually so we can comprehend it a little bit better because I find that looking at images helps me to better understand what is being said or what is being taught or what is being researched or experimented. And these are just my references.